So is £20 billion enough a year, enough extra to save the NHS, or will no amount of money ever be enough for our ailing healthcare system? Joining me to discuss this in our central London studio, GP and spokesperson for Health Campaigns Together, Dr. Louise Irvine, and James Kirkup, who is Director of the Social Marketing Foundation. Hello to you both. Thank you very much indeed for joining us on Sky News this afternoon. To you, Doctor, first of all, an extra 20-odd billion pounds a year enough?
No, it's not enough. This is 20 billion extra by, I think, 2023. This amounts to less than 3% annual increase on the total NHS budget, and actually will just bring us to the level of funding as a percentage of GDP that we were spending on the NHS in 2009. It's not going to be enough to reverse the terrible damage done to the NHS of 8 years of austerity, and it means that my patients and my colleagues are going to carry on seeing terrible queues, long waits for treatment, lack of care for our mental health patients who are just not getting the service they need, ambulances stacking up in A&E, long waiting times for cancer treatment. That is not going to be fixed by this increase. It sounds like a lot, but actually over time it is not enough to meet not just the growing needs of our population, but also to remedy the terrible damage that's been done over the last 8 years.
Sounds like a lot, James. It sounded like a lot when it was written on the side of a bus, didn't it?
It did. Back to your question, will it be enough? The answer is it depends on how it's used. And we have this conversation about the NHS, about health funding, and naturally enough, we always end up talking about how much money goes in. And then, after the fact, we start talking about what it's used for, what comes out the other end. So there is a real problem that we don't spend enough time talking about NHS productivity because it's boring and technical and complicated. And actually, there are bits of the NHS that use the money really well, and there are bits of the NHS that use the money less well. And if you could bring the lowest performers up to the level of the best, you might well get to the point where this £20 billion really delivers some bang for the buck, even though, as Louise points out, bear in mind, this is money for NHS England. It's not covering public health, it's not covering prevention, and we're not even touching social care yet. So it's only a bit of the picture that we're talking about.
Doctor, the problem is that the National Health Service is no longer fit for purpose like it was when it was first set up 70 years ago. We've got an ageing, ailing population. We do not have enough funds to look after everyone. We have to look again at the business model.
No, I disagree. I mean, we are the sixth richest country in the world. We can afford to look after our patients and our elderly population. The increase in the older population has been steady and gradual, and we can easily have planned for it properly if we had the will to do so. I'm glad that you brought up the issue of how is the money going to be spent and the overall NHS structure. Over the last 2 decades, and more so in the last decade, the NHS has been progressively fragmented. There's been more and more outsourcing and more privatisation, more and more chaos from the competition and competitive tendering. That is where the waste is. That's where the money could be saved. Everybody knows, every health economist knows that has studied these issues, that a publicly provided healthcare system is not only more cost effective, more of the money goes to where it's needed, but also it is actually better for patient care. It actually delivers better joined up care. So that's where I would be saying we should be putting our resources if we want to make sure that any increase in funding actually goes to where it's needed. But this isn't going to be enough, and the NHS has not been put on the right footing. This is its 70th year, and if we want it to continue for another 70 years, we do need to not only fund it properly, but make it a public service once again. And that's exactly why we'll all be demonstrating and celebrating the 70th birthday of the NHS on Saturday, 30th of June. So please come and join us at 12 o'clock.
Okay, James.
Thank you.
Well, can I just say sort of respectfully, I run a think tank that employs some health economists, and we've just looked at the question of NHS productivity, and we don't think that who provides care is necessarily central to this question of productivity and efficiency. Frankly, publicly owned and provided bits of the NHS can be as inefficient or as efficient as privately owned bits. And also, on just this point about privatisation, it's easy to talk about privatisation, but Louise is a GP. GPs are private contractors. GP surgeries are not you could say private providers. It doesn't matter so much who is providing the care, private or public. What people really care about is whether or not it is publicly available, free at the point of use. So can we, again, worry less about the dogma of private versus public and just look at the boring, tedious, facts about what's productive, what's good, what's bad, what's not.
Doctor, if 20-odd billion pounds extra a year is not enough, how much is?
Well, all independent authorities on this matter have said that the NHS needs at least a 4% annual uplift. That's the IFS, that's the OBR, that's the King's Fund, that's the Health Foundation, that's the Nuffield Trust. So at least 4% per annum. So this, what we're being told we're going to get is less than 3%.
Well, the Prime Minister says 3.5%, doesn't she?
Yes, because she did what your other interviewee said. This is the usual smoke and mirrors with the Tories. I'm sorry to say they're going to increase just a section of the NHS England budget, but they're not going to increase funding on public health and prevention, on capital and equipment, on doctor and nurse training and education. And on social care, which is very closely linked to the NHS. So these are all vital aspects of our entire healthcare system that will not receive extra funding. And therefore, the overall funding increase, if you look at the whole NHS budget, is just less than 3% a year, which is significantly less than the minimum that all the reputable authorities have said is needed. That's why we are not, we're pleased to hear that any increased funding is of course welcome, but it's certainly not going to be enough to stop us having those pictures of people queuing up in A&E,
Just a quick thought from you, Doctor, and then I've got to go back to James. We're almost out of time. Where should the money come from, Doctor?
The money should come from, we are, as I said, one of the richest countries in the world. We can spend it, we can come fair taxation, which means actually getting some of the companies that don't pay any tax to start paying tax, including healthcare companies. We should make sure that any tax burden doesn't go on the poorest and the most disadvantaged, because they're already suffering adverse health effects from austerity. And also the government should borrow. Of course it should borrow, because investing in health is investing in the infrastructure of your country, your people, your economy.
Okay.
And the government can afford to borrow for that.
OK, so more taxes, James, and more borrowing.
I mean, that's inevitable, to be honest. I mean, the state of public finances are such that if a government is going to start spending more on public services, the political climate won't allow the old coalition approach of cut somewhere else to find the money. So, yes, there will be more tax and there will be more borrowing. Politicians doing this should be honest about that. Look people in the face and say that's what's going to happen. And then we can have a serious conversation about where that tax should come. I mean, I think, for what it's worth, that I wish this announcement had waited until later in the summer when the government was going to publish its green paper on social care. Then we could do the whole thing in the round, talk about social care and the NHS, and get back to a grown-up, difficult conversation with the electorate, which talks about maybe taking some money from housing assets. People who own houses have seen the value of their houses rise an awful lot in the last few years. Maybe we should look to try and take a little bit more money from that stock of wealth and use that for a better integrated, better coordinated system of health and social care.
OK, good to talk to both of you. Thank you. Thank you.
Thank you.
Let us know your thoughts. Extra 20-odd billion pounds a year for the NHS, depending on how you do your figures, either 3 or 3.5%. Let us know what you